Dr. Hantel, what does post-access enrollment mean, and why is it important in understanding disparities in AML clinical trial participation?
Sure. So we have kind of a lot of steps between somebody getting diagnosed with AML and somebody enrolling on a clinical trial. And the first step is actually being at a site where clinical trials are offered. And in a lot of cancers, that is kind of the major barrier to getting on trials, in that a lot of people are taken care of at clinics or at hospitals where there just aren't clinical trials available for their cancer at all. Um, and so after that, we kind of have this idea of a lot of other steps that are needed, even when the person is at a site with clinical trials. And that's kind of that whole idea of what post-access enrollment refers to. That, in a very granular way, means I'm at a site that has clinical trials. Does that site now have clinical trials that are right for my specific type of AML? And then after that, am I actually eligible for that particular trial? And after that, do I want to participate? And after that, is it feasible for me to participate? Because there are a number of other kind of factors that come into a clinical trial, like maybe extra visits, maybe extra tests, a lot of other things that come into trial participation beyond just what the actual trial is studying. And so all of those things kind of together mean post-access enrollment. And there are, concerns for acute leukemia with respect to post-access enrollment, because it seems like those kind of bevy of steps are where patients who are historically underserved and from minoritized backgrounds are being kind of excluded more from clinical trials, or at least not allowed to participate as much. And we don't know yet if there's one particular step, but it seems like from all the evidence that we have that it's kind of a combination of slightly more difficult steps at each point in that process that make it so in the end, those groups are less likely to enroll and less likely to participate. In the past, there was a lot of, I would say, almost blame put on some of those groups, because it was thought that they were more mistrustful of the medical establishment. And I think for right reasons, at least in the past, the medical establishment has done horrible things to minoritized groups in this country. But we've recognized that it's more a lot of structurally racist barriers that are put up in front of those people, and that the good evidence now is that people, no matter their background, really want to participate in clinical trials to the same degree, and that it's more kind of the structures that the walls that we put up in front of them are the things that are stopping them from enrolling. Could be insurance, it could be access, it could be eligibility criteria, it could be kind of all of those other burdens that are required, like having a caregiver and everything else. But together, kind of everything after access seems to be just as important for getting people onto clinical trials in AML, whereas that's not as much the case in some other diseases.
Okay, thank you. And do you have an activation tip for that question, Dr. Hantel?
So my activation tip for this question would be, when you're asking about clinical trials, really ask not only what the trial is about, which is very important in deciding if whether or not it's appropriate for you, but ask everything about the logistics, and ask everything about what it would mean for you as a patient. There are some trials that are doing wonderfully about this and really trying to make sure that people are able to continue to live their lives while enrolling and participating in clinical trials. And so I think by kind of looking at it as, who am I as a person, and does this fit with me and fit with also how I want to give back to other people who have leukemia, that's kind of one way that we help people think about whether or not they want to participate.
Okay, thank you. And everything you talked about, it sounds like clinical trials are so complicated. If patients can have an advocate with them most of the time when they're going to these appointments, it might be super helpful too, to take somebody with you. There's a lot of information being thrown at patients, especially when it comes to clinical trial information. So thank you.
I completely agree.